When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spiced Cranberry is a refreshing way to shake things up this sipping season. And only for a limited time. Sprite. Obey your thirst.
Oh, Hilton stay, your beds are soft and cozy. No lumpy couch, no stiff futon, no shower line at crack of dawn. Oh, Hilton stay, oh, Hilton stay.
When you want holiday comfort you can count on, it matters where you stay. Enjoy comfortable rooms and friendly service when you stay with Hilton instead. Save up to 25% this season when you book with Hilton. Hilton for the stay. Terms apply.
The Dental Download podcast is your source for insight from conversations with fellow dentists, specialists, and leaders in the industry. With new episodes every Monday morning, I'm your host, Dr. Haley. Let's get into this week's episode. All right. Hi, everyone. I have another guest with us here today, Dr. Hannah. I'm so excited to have her here. I met her through TikTok, which has been a trend for a lot of the guests I've been having on lately. But can you introduce yourself a little bit and tell us about your background?
Yeah, I'm so excited. Thank you for having me. I'm Hannah. I always go by Dr. Hannah Banana with the kids because I just feel like it's fun and funny and they remember. So I went to dental school at the University of Pittsburgh. I graduated in 2021, so kind of went through that whole COVID dental school right when I was in the middle of starting clinic and seeing patients. Kind of COVID happened. So graduated in 2021. I did an AGD in New York at Columbia for a year. And then while I was there, I applied to pediatrics. I did peds at St. Christopher's Hospital for Children, which is in Philly. So I was there for 2 years. I was the chief resident in my last year. Only one chief and 16 residents, so it was a lot. And then after that, I'm from Pittsburgh, so I moved back to Pittsburgh for 9-10 months, and I was an attending at UPMC Children's Hospital for Pittsburgh. So that was really cool. I loved working there. And now I'm in San Antonio. I just moved here in April, so fresh to San Antonio. And I'm working in private practice now.
That's awesome. And I don't even think I said at the beginning, I know you mentioned you went to pediatric residency, but you're a pediatric dentist and you just passed your boards, right? Your oral board.
Yesterday we
so
found
exciting.
out. Oh my gosh, the best feeling and very surreal. I was sitting in my backyard last night and I started crying and I was like, it's just crazy that you spend all these years, we spent our entire 20s working for this and just to reach that goal and pass oral boards. And they gave us a score breakdown, so that was pretty cool to see. It just was a really, really surreal feeling and just finally reached the goal. I've always wanted to be a dentist too, so since I was a kid. So I always say I feel like I've achieved my lifelong goal by getting here. And passing boards was just the cherry on top.
Yeah, that's amazing. I was so happy for you when I saw that video come up because I
Thank you.
can't even imagine how much pressure it is and scary it is going through that and then having to wait to find out how you did, but relief.
Oral boards was quite the experience. I can't believe that I did that. Afterwards, my co-residents and I were we did that. It's just a whole other type of exam and you prepare as much as you can and you're I hope I do okay. And it was very high stress and we had to wait. It was 7-ish weeks for the results. But yeah, that was so nice to find out yesterday.
You might not know this because it's kind of a random question, but how many, generally speaking, pediatric dentists are graduating from residency at the same time? Is there 400, 200, 1,000?
That's a great question, and I have no idea. I really have no idea. I don't even know how many people took boards. I'm sure there's statistics out there, but I don't know. And that's a great question, and probably after this I'm going to Google.
I know, because I'm just I saw a couple other people in your years of all this that were taking them too and just found out if they passed or not. So I was I wonder, is this 100 people, or is this like 800 people that are going through this at the exact same time? And I'm sure, some people don't pass and they're retesting next year or
Yeah.
something, but wow, that's awesome.
Yeah.
What was it like walking into the room? Like, I don't know how much you're allowed to share, but how was it
Yeah. I
formatted?
mean, I just like your heart is pounding. But once you sit down and you start taking the exam, like you kind of forget about it. Like you just do it. I mean, my friends that had taken it before were like, you do this every single day. Imagine a new patient is walking in your office and you're finding out, their whole story, their medical history. Have they been to a dentist before? Like we do these things every single day. So once you sit down and start taking the exam, like you're just doing it and it kind of flies by. But still the whole time, like I was pretty like uptight, like I could feel myself sweating. But yeah, you just like have to sit down and do it.
Is it kind of structured like how parts of like the multiple choice dental school boards are, where it's like patient cases you're saying, and then they kind of ask you
Yeah.
sequelae questions
Yes.
about that?
Yes,
Okay.
exactly. And they could ask anything. They could ask like about medical history and go into that and like medications. They could ask about the treatment plan. Like if you're going to do sedation, ask about what medications. It's really like you have no idea where they're going to go with it. And yeah, yeah. It was
And how long were you in there? Is it like an hour or like
2 hours.
2 hours?
So
Yeah.
it was me and two examiners, and the first like session is an hour, and then we got a break. They switch examiners and then another hour. And the first hour I was like, oh my gosh, an hour is already up. And then the second hour, I feel like that felt longer, I think, because I was like, oh my gosh, this is about to be it. I'm about to be done. But yeah, and then you're like the best feeling, like, oh my gosh, I can't believe I just took that. I just did that. Like it's kind of like an empowering feeling.
Of course. Yeah. I mean, you work, it's like running a marathon, like training, and then doing it. And then now you just passed, you just ran through the finish line. Like you did it. It's
Yeah.
amazing.
Yeah. Yeah.
That is so cool. So, where do you go to take this? Like, do people have to travel to only certain places offering
Mhm.
it? Do they come to every state? How does it work?
Yeah, it's only offered once a year. So it was in Raleigh, and it's a week long, and they just assign you a day. So I was on Friday, like I'm like, of course, the last day. And so I went on Wednesday night because I didn't want to travel Thursday. I was like, felt really nervous about that. So I went Wednesday night. I was there Thursday, just like reviewing my materials, took it Friday, and then I left first thing Saturday morning. Before this, you have to take a written qualifying exam. So it's kind of like a two-step process. And yeah, once a year for both of them, once for written and then once for the oral exam.
Awesome. I want to talk more about, your work in pediatrics and how all that's been and residency and everything, but I want to backtrack first to you deciding you wanted to be a dentist. You mentioned you've always loved dentistry and kind of knew you wanted to be a dentist since you were a little kid. But what was your pathway like of getting into dental school, and
Mhm.
how during dental school did you land on pediatrics?
Yeah, so I went to Pitt for undergrad too. My dentist growing up, he went to Pitt for undergrad in dental school, and I was like, if he can do that, I can do that. So that was kind of my inspiration. I was always like, if I can get into Pitt for undergrad, like it's going to set me up to get into Pitt for dental school or get into any dental school, really. So I had a little bit of a hard time in undergrad. Like I didn't have the highest GPA. I went to a really, really small high school, and I think I just went from being kind of like a big fish in a little pond to a little fish in a big pond. So I had a little bit of a hard time in college. So my GPA was like so, but I was super, super involved. And I feel like that's carried me kind of through life, like being well rounded. I think being a well rounded candidate can get you really far. So even though maybe I didn't have the best GPA in undergrad, I was so involved. I was in a service fraternity. I always was working too. I had work study jobs. I worked in the dental school. I studied really hard for the DAT and got a pretty good score. So that helped me, I think, get into dental school to be well rounded. And I only got one interview. So it used to be how, like, if you interviewed before December 1st, you found out on December 1st, and then you could get accepted. So before December 1st, I only had one interview and it was at Pitt and I got in. So I'm like, all it takes is one. Afterwards, I had like some other interview offers, but I was like, nope, I want to go to Pitt. So all it takes is one. I got into Pitt. That's where I went. I liked Pitt for dental school. I think we had a pretty good education. And I was always interested in pediatrics. My whole life, like in college, I did tutoring with kids. I don't know, I just felt like gravitated towards that population. Like I thought I got along with kids really well. They liked me, they trusted me. So in dental school, I was super involved in the pediatrics club. All 4 years of dental school, I was Give Kids a Smile Day coordinator. I was a co-president of the Peds Club. And same thing in dental school too. I feel like I was well-rounded. I wasn't like the top 10% of my class or anything. I had a good GPA, but I was a well-rounded candidate when it came to applying to residency. So I always was thinking about peds, but then when COVID happened, the applications for residency opened and we weren't even back in clinic yet. So I was like, I don't know if I can apply to peds. I don't even know when I'm going back to school. So I kind of was having like a dilemma. I was like, I don't know. Do I apply to peds? Do I apply to a GPR? Because I feel like in peds, I was like, I really want to be confident in my skills leaving dental school because kids can pick up on it. Like if you're nervous, I feel like kids can read your energy. So I was really torn in dental school on what to do. I ended up applying to GPRs and AGDs. I had a little bit of a runaround with that. It was like this whole saga. I didn't match. I got a post-match spot at Columbia. I went to Columbia, and as soon as I started, I was like, this is not for me. General dentistry is absolutely not for me. Like, I'm applying to peds. So when I applied to peds when I was in the AGD, I was applying a little bit late because I started residency in July. The applications had already been open for peds. So I was kind of scrambling, but I was like, I have to apply or else I'm always going to question it. So I applied a little bit late. That kind of meant I couldn't apply to maybe every program I would have because some of them, the applications closed in August. So I applied to like what was open, what I thought fit what I wanted in a program, and got interviews. I matched at St. Chris, and I am so happy I applied to peds. I do not think I would do well in general dentistry. Like I love pediatric dentistry. I love the kids. I love my job. So I'm so thankful that it worked out that way because I really think like this is what I'm supposed to be doing is pediatrics. I trusted myself and trusted my intuition and was like, I'm just going to go for it. And it worked out. And here I am.
This episode is brought to you by Indeed. You're ready to move your business forward, but first you need to find the right team. Start your search with Indeed Sponsored Jobs. It can help you reach qualified candidates fast, ensuring your listing is the first one they see. According to Indeed data, sponsored jobs are 90% more likely to report a hire than non-sponsored jobs. See the results for yourself. Get a $75 sponsored job credit at Indeed.com/podcast. Terms and conditions apply.
The Freddy Fazbear box just dropped at Popeyes for $7.99, and it's scary good. Garlic palm tenders and cheesy bites with marinara sauce. Upgrade to the deluxe box for $12.99 and get a 20-ounce drink in a cupcake cup. Dig in before it's too late. Try the Freddy Fazbear Crunch menu, now at Popeyes. See Five Nights at Freddy's 2, only in theaters. Love that chicken from Popeyes. Limited time at participating U.S. restaurants. Prices may vary.
As a pediatric dentist, my guest today knows that creating a fun, stress-free environment isn't just nice, it's essential for successful visits. Patients feel more at ease when they're comfortable, and the right equipment can make all the difference. That's why I recommend checking out ADEC. ADEC's specialty chair is ideal for small patients and small spaces. Compact, accessible, and still incredibly comfortable. When it comes to keeping everything organized during busy appointments, the ADEC Specialty Workstation is a lifesaver. It combines the ADEC Inspire dental cabinet with an ADEC delivery system, so your tools and tech are always right where you need them, all within reach. Together, this innovative equipment encourages an ergonomic and efficient treatment flow that helps you make every visit a positive experience. Check out the link in my show notes to help you and your patients sit comfortably. Do you have any tips for people that are applying to residency now for pediatrics?
So I think number one, programs are really different. And I think you should know what you want out of a program. So I wanted a lot of operating room experience, and not every program you do a ton of ORs. Some programs are more operating room heavy and some are more oral sedation heavy. So I took that into account, like, were they doing a lot of operating room work? So I think that's one thing, is really knowing what you want out of the program and trying to find programs that align with that. I think taking call can sound really scary, and I was really hesitant. I was like, I do not want to be on call. But I did go to a program with call, and I would say don't be afraid of going to a program that takes call, because you really learn so much when you're on call. And you need to know that information, like on boards and everything. You have to know how to handle traumas. So don't be afraid of call. And I always think too, it's important, like, where are the programs located? Like, do you want to live in New York City for 2 years? Do you want to live in the middle of nowhere 2 years? Like, you have to be happy in your program. I shared recently on TikTok that, like, there were a couple programs I just didn't even put on my rank list. And I think that's a little bit controversial, because some people are like, well, if you want to be a specialist, just put them on the list. But that's 2 years of your life. So you have to be happy. You have to be happy in the city you're living in. You have to be happy with your program. Like, your mental health has to be good for those 2 years, because it's hard and it's stressful. So I think that's important too, is like, are you going to be happy in that city? Are you going to be happy at that program? And also, when you're applying to, you should know, like, why you're applying to peds. Everywhere you go is going to ask that, like, why pediatrics? And I think the biggest thing interviewing with peds is, like, just be yourself. I feel like pediatric dentists, for the most part, are so chill and so nice. Like, I don't think anyone wants to be scary at interviews and things like that. So just, like, go in, be yourself, show your personality, and try and find a program that you can see yourself in.
Yeah, definitely. So you mentioned that during residency, you were chief resident in your last year.
Mm-hmm.
What was residency like? Like, what was a typical day like as a pediatric dental resident?
So my residency was very resident run. We had attendings, obviously, but if we had questions, normally it was like we would talk to our co-residents about it first and then go find an attending. So it was super resident run, very busy. We didn't run our own columns, which is kind of odd. So it turns into this, like, you just take the patients as they come. So I think with that system, you really get out of it what you put in. If you're seeing a ton of patients and doing a lot of work, you're gonna have really good experience. And if you're not doing that, you might not have as good of an experience. But we were really busy. We weren't super academic heavy, so we had lectures, but not a ton. Our normal clinic day was, we started patients at 8 o'clock and our last patient was like 3:30ish. So we had really good work-life balance. That was something that was important to me. We took call, but because there were so many of us, there were 8 per year, we weren't on call like every third day or anything like that. We took call by the week. So I think in 1 year, we took about 6.5-ish weeks of call. And call was like hit or miss. Sometimes your pager is going off every single night and sometimes it never goes off. So we had some call. We had a ton of operating room experience. So how our program worked is you did ORs like at the very end of your first year and all of second year. So we would go up, we would start our patient, our attending would be there, do the timeout with us, they would treatment plan with us, and then we would sit down and do all the work. The attending was like, you got it. I think how a lot of programs work is it's split mouth. The attending does half and you do half. But they were like, you guys got it. If you need anything, you let us know. But we would sit down and do the whole case. So we did so many ORs and we were running the full case, which I think is unique from what I've heard. And I loved that about my program, how much we were in the OR. I love being in the OR. So I really love that about my program. We didn't do a ton of oral sedations. I think it's kind of like hit or miss on the program. Some do a ton and some don't, but we did enough that we needed to. and really, really busy. It was in Philadelphia. I mean, there's so many kids in Philly. It's a big city. There's a lot of kids that need dental work done. So there was no shortage of patients for us. And sometimes it was chaos. We were running around like chickens with our heads cut off. But sometimes that's peds. Peds offices are busy. So I liked my program. It has its flaws. It has its strengths. I think I got a really, really good clinical experience, which that's what I was looking for, was really strong clinical experience. And I passed boards, so I got a good education too.
Yeah, I mean, that's a good testament there. And I'm
Yeah.
sure, I mean, in residency, it sounds like you were in the OR a lot
Mhm.
and then transitioning to graduating and then working in private setting. So what is the day and scope of practice like when now you're in a private practice setting?
Yeah. My first job in between residency and now in Texas, I was in a children's hospital. So that was like also a ton of OR. I was in the OR probably like 3 days a week and then seeing patients in the clinic 2 days a week. So that was like pretty similar to residency. But now in private practice in Texas, it's pretty different. I mean, I'm doing a lot of oral sedations, which in residency I didn't do as much. But it seems like in Texas, at least in San Antonio, everyone's doing a lot of oral sedation. So in the mornings, maybe I'll have like 3 oral sedations, 4 oral sedations, and then running full hygiene columns. I'm about to start a new job though. In that office, I'll be doing cases under general anesthesia. So I'm really excited about that. They have a dental anesthesiologist that comes in once a month and we do cases. So I'm excited for that. But it's definitely a different workflow in private practice, a little different than what I'm used to. But again, I feel like in peds, you just like have to go with the flow. You have to be used to being busy. So even though it's different, I feel like I'm still prepared for like this kind of job.
Yeah, and the techniques you're doing once you start working is similar
Yeah,
scope, maybe.
yeah. I will say the treatment planning is probably like a little bit different. Like when I was in residency, we were not doing zirconia crowns or anything like that. In private practice, especially the new office I'm about to go to, a lot of parents want zirconia crowns. So I always like offer all the options. I'm like, these are what the options are. Talk about the pros and cons. So I think that's going to be a little bit different for me, like a little bit more aesthetic zirconia crowns as opposed to stainless steel. But I'm excited about that.
Yeah, it's always fun to start to do something a little new.
Yeah.
I would love if you're willing to talk about, I know you mentioned you got married last September
Hmm.
and your husband's a oral surgery resident.
Yeah.
Did you two meet during dental school?
Yes, we met in dental school. We like knew each other for a year and a half before we started dating. And then he's a year older than me. So when I was a fourth year dental student, he did a GPR that was about an hour away from Pittsburgh. Super oral surgery heavy. I mean, he always wanted to do oral surgery. He's had a little bit of a non-traditional route to getting to oral surgery. He did the GPR, he's done 2 internships. I mean, he's very, very dedicated and driven and like always working towards getting into oral surgery. So the most recent time when he applied, he didn't get in, but there were a handful of post-match openings, and one was through the Army. And he was like, "Oh, I'm gonna apply to this." I was like, "Okay, like yeah, whatever." And then the Army called him and was like, "You have a great like application. We want to take you for the program, but you have to join the Army." And so we were like, "Okay, I guess that's what we're doing." So he's a resident, an oral surgery resident through the Army. So it's a little bit different than like what we're used to. Like ever since we moved to Texas, it's a lot of new things, just like seeing how the Army is, how that works. And his residency is very, very busy. There's only 2 level 1 trauma centers in San Antonio. And San Antonio is a huge city. So he's getting a ton of experience. This is his first year in residency, and he is so busy, which is good, but just very, very busy.
What advice would you have for someone whose partner is also like pursuing some kind of specialty degree training, like at the same time that you are?
That is a great question. For us, the timing just kind of worked out because when I got into peds, he hadn't gotten into residency yet. So we kind of like focused on me and got me through residency. And then that's when he got into oral surgery in San Antonio. I think like the biggest thing is just supporting each other. Like he has always been my biggest support system. Like he was like, wherever you get in, that's where we're going, no questions asked. And then likewise for him, like he was like, I'm gonna do it through the Army and we're gonna move to San Antonio. I was like, okay, I mean, that's what we're here for. That's what we do for each other. So being each other's support system, definitely. And then also I feel like he's so busy and so stressed in residency. I try and be like super empathetic because I was just in residency 2 years ago. I mean, oral surgery, or a year and a half ago. Oral surgery is like obviously way different than pediatrics, but I still know what the stress is like and, the stress of being on call and if you get called in the middle of the night. So I try and be like super understanding and like empathetic of what he's going through. And I really try and like minimize whatever stress is going on in our life so he doesn't have to deal with it. But I think the biggest thing is just supporting each other. It's going to be hard, it's going to be stressful, but like you're a team. And when you get to the end goal, it's going to be the best.
Have you found in this case, you had to, move across the country to look for jobs and everything. Is it pretty easy to find a job as a pediatric dentist, or are there not a lot of openings? What have you noticed?
So whenever I was moving from Philly to Pittsburgh, I feel like I didn't have as hard of a time, but I'm from Pittsburgh. So if I saw an office that was hiring, like I knew the area it was in. Moving from Pittsburgh to Texas, I found it a little bit harder because I'm looking at these jobs and looking at these offices and I'm like, I have no idea what this city is like. I have no idea what the commute is like. I have no idea about anything. When I first took a position in San Antonio, I was still living in Pittsburgh and I was like, I'm just taking what I can get and I'm crossing my fingers and hoping it works out. I'm starting a new job next week. And I think once I'm here, like it kind of was a little bit easier to find the right office that matched what I was looking for. So it can, I think, be a little bit hard if you're not familiar with the city that you're going to. But I also think we need to remember the first job we take doesn't have to be the dream job. And I think that's something I struggle with. I'm like, oh, I want to find a job and I'm going to love it and it's going to be great. So if it doesn't work out, like my job right now, I kind of was a little upset because I'm like, oh, I wanted it to work out, but I think there's a better fit. So I think remembering too, like, it's okay to find a new position if you don't love the first one. Like, you're not married to it, you don't own it. Contractually, if you have to give X days notice, you do that, but you have to go to work every day. So don't put a lot of pressure on yourself to find the perfect job right away. And if you feel like it's not a good fit, just look for something else. But I think it can be tricky finding a job in a city that you're not living in if you're not familiar with it. That's how I felt coming to San Antonio.
I mean, it makes a lot of sense because the community of where it is going to tell you a lot about the patient population and maybe, again, how your philosophies and goals are going to fit in with that. But if you've literally never been there, how do you know?
Right.
That makes sense. It takes a little bit to settle into somewhere. I feel like the general stuff that people think about pediatrics is that it's just like really intense volume of patients because, you have to be quick. And I feel like there's also people say, you have to be like really spunky and fun and like all that to just kind of put on a little distraction while you're getting the work done. Yeah. Do you feel like your days are very, very busy, full, and like, do you feel drained after that, or it just suits you so well that you like love it?
I mean, it depends on the day. And I think even for pediatrics, that's probably accurate too. I mean, I definitely feel like I'm putting on a show. I saw a TikTok once that was like, pediatric dentists, you just feel like you're a clown all day long. But I definitely do feel like I'm putting on a show. Like with the kids, you have to be on, you have to be in a good mood, you have to be super bubbly. So I think if you have a really good team in the office, it can help relieve your stress throughout the day. But I mean, we all have those days. There's some days like I go home and I'm like, I am so exhausted. And sometimes my husband's like, why? And I'm like, just all day long, all day long. It's like, hi, I'm Dr. Hannah Banana. Hi, I'm Dr. Hannah Banana. I love my job. And like I said earlier, I wouldn't want to do anything else. But for the most part, I don't feel like super drained. I feel like this is just what I'm meant to do. But of course, I have days that I go home and I'm like so exhausted. I just want to lay on the couch and like not think about anything. But having like a really strong team, I think in peds, in dentistry in general, but in peds is super important. Having a really strong team, a really efficient team, and a team that you can really trust, because it's going to help you get through the day.
Looking back on your training with pediatrics, is there one thing that kind of sticks out that you struggled with and had to work through to get better at, whether it was like interacting with the kids or a specific clinical skill or confidence? Like what or something that sticks out to you?
Yeah. I think one thing is handling conflict. I feel like in residency, like I definitely could have done a better job. I always try and like be someone people want to work with and be in a good mood and all of that. But I feel like I can do a better job with like dealing with conflict within a work environment. I don't like to deal with conflict. I don't want people to be mad. And that's one thing I always try and work on is like, we're professional, let's talk about it and just move on. Another thing too, I think I used to be scared to do procedures I wasn't familiar with. Like in residency, we did not do strip crowns at all. And when I went to my first position in Pittsburgh, that's all they did was on the like anterior teeth with strip crowns. So I used to just feel really scared to do procedures I'd never done before. So I think in residency, that's a huge thing. Like if I were back in residency, I'd be like, I want to do everything. Like at least once. I want to do every kind of crown. If they're doing tongue ties, I want to do it. If they're doing frenectomies, I want to do it. Now I don't feel that way anymore. Like I don't feel scared to do procedures. But I would say like in residency and when I first got out last summer, I just felt nervous to try new things. But now I don't feel that way anymore. And I think in residency, like try and do as much as you can. So when you get out, you don't feel that way.
And I know obviously in residency, a lot of them are like, affiliated with hospitals. Like you said, you're in the OR a lot, things like that. Do you have an interest in getting back into hospital dentistry at some point, like a couple days a week? Or is like, how does that even work? You have to apply or what?
I love hospital dentistry. I think there's such a need for it. I'm really passionate about it. And I love being in the OR, like I said earlier. So when I was in Pittsburgh and I was working at the Children's Hospital, I was like, I hit a gold mine. Like I think I just luckily fell into the position that they had some people leave and I was applying and I saw they had an opening and I was like, take me, please. In San Antonio, I don't really see a huge market for pediatric hospital dentistry. So I feel like maybe it's city dependent. I would love to be affiliated with a hospital. Like if I was attending for a residency program one day a week, or even if I just have hospital privileges. It just seems like right now where I'm at, there isn't really a market for that. I do love hospital dentistry and I would love to get into it again in my future. I hope there is a future where I can work in a hospital again. I think it seems city dependent in my opinion, but I've only been out of residency for a year and a half, so I'm not too sure, but I would love to do that again because I love the operating room, even like medically complex patients, being able to treat them and like have a space, because a lot of them I've heard parents say like they have a hard time finding a provider for some of these kids. So I would love to work in that space again, hopefully in the future.
Yeah, I mean, you're just getting started. This is like
exactly, yes.
Lots of opportunity ahead.
Yeah.
That's super cool. So before we wrap up, do you have any kind of closing thought or encouragement for people listening in?
I think I said this a little bit earlier, but like trust your gut. If you are interested in a specialty, like, don't be afraid to apply to residency. One thing too is I was like, I have all this student loan debt. Like, I just need to do the GPR and start working. It's not 1 year or 2 years or 3 years of residency. Like, in the grand scheme of life, it's not that big of a deal, I think. So if you are interested in a specialty, I think you should do as much as you can in dental school. Go shadow the residents if you have residencies at your dental school, and just like go for it. I'm so happy I did peds. Like I said, I do not think I would have done well in general dentistry, and I'm so thankful kind of my path ended up the way it did, because it kind of gave me that push to apply to peds when I was in the AGD. So I would really like encourage people, if they're thinking about it, to do it. I think pediatric dentistry is the best. I love my job. I love the kids. I think there's tons of different avenues for this career. Like, you could be in a hospital, you could be in a private practice. A lot of people now are getting into like airway dentistry and things like that in pediatrics. So there's so many avenues for this specialty too. Yeah, I think just go for it. And like I said, don't be afraid to do a couple years of residency. I think in the long run, it pays off. And if that's what you're going to be happy doing, then it's totally worth it. And if you don't get into residency, just keep going for it. I think my husband's a good example of that. Like, that man has worked so hard to get into oral surgery. So like, don't give up. Just, if that's your dream, be determined. And I think like he is proof of that determination and hard work, like, it will pay off. So if you don't get in, just keep trying if that's really what you want to do.
I love it. Thank you so much for all of your encouragement and sharing your story today with everybody. If they want to follow your journey or ask you any questions, where's the best place for them to connect?
I would say on TikTok. I check my DMs there more than on my public Instagram. So TikTok is good.
I can link it with this too.
Yeah. I like love posting on TikTok. I love talking to people on TikTok. I think it's a great way to meet people. I've met so many people in our profession through TikTok. And I'm so happy to talk to people. Like, I will answer any question. I will talk to them about anything. So totally reach out to me if anybody has questions.
Awesome. Thank you so much.
Thank you so much for having me.
Hey, Ryan Reynolds here for Mint Mobile. You know, one of the perks about having 4 kids that you know about is actually getting a direct line to the big man up north. Mm-hmm. And this year, he wants you to know the best gift that you can give someone is the gift of Mint Mobile's unlimited wireless for $15 a month. Now, you don't even need to wrap it. Give it a try at mintmobile.com/switch.
Upfront payment of $45 for 3-month plan, equivalent to $15 per month required. New customer offer for first 3 months only. Speed slow after 35 gigabytes if network's busy. Taxes and fees extra. See mintmobile.com.